This video will provide you with an overview of occupational therapy and address the common signs and symptoms to look out for when considering a referral to occupational therapy services in early childhood. Occupational therapy focuses on helping children improve their ability to participate in meaningful daily life activities or occupations.
I have been astonished by how well kids do with OT, and usually over a fairly short time span. It touches on something in them that kind of reroutes their pathways and just makes life easier for them, or better.
The domains that occupational therapists address are motor, sensory processing, cognitive, social-emotional, communication, and adaptive behavior. What are the common diagnoses OTs treat? OTs can work in hospitals, private clinics, schools, and the home. Children with or at risk for a developmental delay or disability may be eligible for OT services. The role of occupational therapists in early childhood is to help children participate in age-appropriate activities and reach developmental milestones.
In the past, kids that didn't receive this ended up clearly diminished and handicapped. And now that they're getting an extensive program, actually do remarkably well and do things that I just never could have imagined.
It's important for early recognition so that we can address and determine delays that the children have before they become a problem in a school-based setting.
Children, if they're not using certain skills, then they don't develop higher level skills.
Well, certainly we think of OT certainly if there's fine motor or coordination issues, but also we think of OT as a much wider area.
Occupational therapists also look at a child's visual motor integration skills. Are they able to imitate lines, which is necessary, of course, for academic success, writing the alphabet. In school is for sensory processing. Is it too loud for the child, and how can we help them deal with the stimuli that's coming in? Is we help children learn to transition, and we also put in modifications in the home, in the school, to help a child move from one activity to another without becoming so frustrated.
How do typical delays present? Difficulties with fine motor skills, motor planning and sequencing, muscle strength and tone, postural control and balance, hand-eye coordination, problem solving and social interaction, transitions and self-care, and sensory integration.
A lot of the children that come to us don't necessarily have a diagnosis. They are higher functioning kids that are kind of slipping under the radar because they don't have a neuromuscular, delay or anything that's obvious. It's usually has to do with their function or their play. So they're struggling in some subtle way that's comes out in a more of a behavioral manner. So it doesn't always manifest itself in their fine motor skills. It can be just how they're adapting or functioning.
Sometimes it's those things like the child is doing things repetitively, the child is avoiding things in life or freaking out, crying excessively and can't get themselves together during a certain everyday life function.
I sought early intervention services because my son wouldn't pay attention. You could call his name and he wouldn't turn around. You'd have to call him 10 times or so before he looked at you. He was clumsy, bumping into things all the time. He didn't have very good balance. He had an aversion to touch. He didn't like to be touched by anyone. He didn't like for you to hold his hand, to hug him, to kiss him.
When you tried to stand her on her feet, she did not bear weight, and she was only rolling to one side. So she would only roll from her right side to her left. She did not roll from her left to her right. So
he wasn't doing things that a 2-year-old would do or a 3-year-old would do, the jumping, the able to pick up a ball and hold it up, or the coordination, it was off. It was a nagging concern. And so I always tell mothers that if you have that small voice inside that tells you something is not quite right, go ahead and investigate it.
If you suspect that a child may have a delay or disability and may benefit from OT services, a doctor or parent can make a referral to the New York State or City Early Intervention Program, or CPSE.
From a pediatrician's point of view, they don't have to say, oh yeah, you need OT, you need PT. They don't even have to address that. They can say, if you're concerned about your child's development, you can have them evaluated by early intervention, and the professionals will help you determine what they need. Parent brings a concern to their pediatrician should take it seriously to refer them if they have, because that's all they need is a parental concern to be referred when they're young.
And this is where OT can be hugely helpful, simply to engage a child.
And parents whose kids had OT services would always give us feedback about it too, and it was always really positive.
So I always say that early intervention is a lifesaver for children who just need a little more help and a little push and special attention and tools to be successful. It changes the trajectory of your child's potential.
To make a referral, please use the links and phone numbers listed here. For further information, please visit the American Occupational Therapy Association website at aota.org.